From our 22 News Broadcast Center, this is 22 News in Focus.
Good afternoon and welcome to 22 News in Focus. I'm Ciara Speller. On March 10th, 2020, Governor Charlie Baker declared a state of emergency, giving the administration more flexibility to respond to the coronavirus outbreak. After 3 years, President Biden ended the national emergency. It officially ended in May here in Massachusetts. But COVID-19 is not gone, and the impact to people's health and the economy continues. So today on 22 News in Focus, we'll be looking at those impacts here in Western Massachusetts. Joining me now is Jessica Collins, the Executive Director of the Public Health Institute of Western Massachusetts. We thank you so much for joining the program.
Thank you for having me.
So tell us a little bit about your mission.
The Public Health Institute of Western Mass works in all 4 counties, and we do research and evaluation on public health issues. We build coalitions on specific issues like asthma, climate justice, and youth mental health, and we also do policy advocacy.
And talk a little bit more about those coalitions and the partnerships in the region and, why it's beneficial to our residents.
Well, it's always better when people are working together as opposed to being siloed. And we have so many tremendous organizations and municipalities and institutions in our region. So if there is a topic, for example, asthma or youth mental health, we basically try to convene people who have strengths and can come together and add value for collective action.
And how about research? What kind of research are you conducting?
Well, it's different all the time, but this past year we just did the Coalition of Western Mass Hospitals community health needs assessments across the 4 counties. And so basically we speak with residents, we speak with community-based organizations, and obviously healthcare to try to understand what are people saying their health needs are.
Yeah, health needs. So what was your role during the pandemic?
Well, during the pandemic, the Public Health Institute really was behind the scenes somewhat. We collected state data and we put it in a way that our region could digest it. We created a COVID-19 data dashboard, which basically shared each county's rates during the time on a weekly basis. And we also stood up a communications campaign to try to put forth the most timely, up-to-date information for folks like outreach workers to be able to take out into their communities and tell people.
Yeah, and so here in Hampden County, Springfield's Department of Health and Human Services was essential to the pandemic response,
Yes.
Not just for Springfield, but as a regional advisor and liaison to the state's Department of Public Health.
Yes.
So how did Springfield coordinate its response both for the city and the region for the Commonwealth?
Yeah, Springfield did an unbelievable job. They very quickly stood up weekly public meetings that were televised. The mayor and Commissioner Colton Harris, as well as Dr. Mark Kerouac and Dr. Rob Roos from Mercy Medical Center. So that basically provided the up-to-date clinical information as well as up-to-date what's going on in the community on the ground, and I think that was very effective. They did work hand in hand with the Mass Department of Public Health in basically providing feedback when the state was sort of pushing out strategies. They were able to say, hey, you know what, this might be a better strategy locally in our region. And so it was very much a partnership.
And Springfield also had one of the largest and continuing testing sites at the Eastfield Mall as well, right? So one thing that was realized was that test sites didn't reach underserved communities. So how were underserved communities reached with testing?
Yeah, I think very quickly people like Commissioner Colton Harris basically said to the state, we really need to bring testing into neighborhoods. And so, while the state was sort of, rolling with this terrible situation, they listened, they worked with partners like CVS or community health centers, and were able to quickly set up testing and vaccination sites throughout the pandemic where people could just walk in their neighborhood and access that as opposed to having to drive to the mall.
Yeah, so let's talk a little bit more about once the vaccines were available, so people were just able to go to these sites and get them. Was there any other, distribution?
At the time, they did not want people coming into their primary healthcare sites, so they really were trying to keep testing and vaccines out of the everyday flow of hospital and community health centers, which of course were dealing with various other, crises. And so That they did put on vaccine days, for example, at parks, or they organized at schools. So they really, or senior centers. So they tried to kind of periodically put in events where they knew people would be at to get vaccinated. Yeah.
I want to ask you about protocols during lockdown. Were there any concerns of municipal leaders and health professionals in the region dealing with state protocols during this time?
Well, always state protocols that they were dealing with, yes. I think for people who are quarantining, that's really where community-based organizations, for example, Revitalize CDC, stepped up and were able to organize deliveries to people's homes. If people needed food or they needed transportation to a doctor's appointment. So that's kind of the beauty of our region, where municipalities were handling certain things and then community-based organizations were able to step up and handle other things.
And the state also launched the Vaccine Equity Initiative. So tell us how that worked.
Yeah, so that came in, I don't remember the exact date, but basically we realized, the Massachusetts Department of Public Health realized that in certain cities across the Commonwealth, known as gateway cities, were not having the same uptake of vaccine rates as, for example, the suburbs. And so they very quickly organized more resources, more convenings to try to get more people at the table in each municipality to say, how can we communicate better? How can we get this information to people and then make the vaccine accessible very quickly? And that did actually provide a tremendous increase in people getting vaccinated.
I also want to ask you, Public Health Institute had and continues to update on COVID data to the website. Where were you getting this information, and why do you think that it was important to keep updating that information?
Yes, so the COVID-19 data dashboard, all of that data came from the Massachusetts Department of Public Health. So they were tracking, they were getting information from healthcare, putting it into like an Excel spreadsheet database. And what we realized quickly was if we took that data and put it in a more digestible format for our region, that people would use it as opposed to having to look through an Excel spreadsheet. And so it was very successful. We heard from many people that they checked it daily, whether it was legislators or people just trying to make decisions for their own families.
Yeah, and just for some of our viewers that might just be joining us right now, just talk a little bit again about, your mission and what it is that you do every day.
Well, at the Public Health Institute of Western Mass, we convene around public health issues. We bring people together to try to understand what are the barriers to health and what are the solutions. We do research and evaluation so that we understand, okay, what programs are working, what do we need to replicate or augment, and then we do policy advocacy for the region.
Yeah. And how can people best learn about your services?
If they go to our website, www.publichealthwm.org, they'll see our dashboard, they can look at our policy priorities, they can see videos from our coalition work. It's all there.
And for our viewers who might not be able to access the web, is there a hotline or a phone number that they can call and be walked through everything a little bit?
Well, absolutely. You can call our number at 413-794-7739.
And so, again, I just wanted to touch on what was realized was that testing sites didn't reach underserved communities, right? And so there's kind of been that whole talk about underserved communities throughout the pandemic. So, what do you think is being done now to help those communities?
Yes, I mean, I think municipalities have recognized, which neighborhoods need more resources, where do we need to get more information, and that will continue to happen. For vaccines, for testing, obviously, people can get the kits and do that now at home. But really trying to build vaccines into a general primary care practice so that for people who do access primary care, that's really important. For people who have less access to primary care, then these neighborhood level vaccine places need to continue to be offered.
And so if there's community members out there who maybe want to provide some feedback or some input now that we are moving away from, the pandemic, what's the best way for them to do that?
I do believe that there is a site on the Massachusetts Department of Public Health where they collect comments and feedback, and I'm sure that they would be very happy to hear from Western Mass residents.
Okay, Jessica, thank you so much.
Thank you.
So how did COVID-19 impact access to health care? We'll have that discussion once we return. You're watching 22 News in Focus. Welcome back to 22 News in Focus. Today we're looking at the impact of the COVID-19 pandemic in Western Massachusetts. During the pandemic, millions of people were forced to stay home. Businesses and schools closed and hospitals had to cancel non-emergency services. So we're going to talk about what statistics say about how our region fared. So first I want to ask you, Jessica, how many people in all 4 Western Massachusetts counties tested positive for COVID-19 prior to the end of the emergency?
Okay, well, as of May 11th, there were about 264,000 people in Western Mass that tested positive, according to the state's COVID-19 data dashboard. Now, we think that is very, very much underestimated because, as we know, people tested in their home kits and then never reported it. So 264,000, we think that's an underestimation.
And in terms of deaths, what are the numbers?
Yes. So fatalities are about 3,300. And again, we think that is also an underestimation because we know at the beginning of the pandemic, people were passing away in their homes. People were not going to the hospital. So as of May 11th, 3,300, about over 2,000 people in Hampden County passed away, 500 in Hampshire and the Berkshires, and 200 in Franklin.
Okay. And the racial disparities in economics and health became more prevalent and more people became aware of those disparities. Some people who were already living in stressful and abusive situations had no recourse to move or to get help, especially children. And people were also struggling financially. So what did your research find when it comes to healthcare disparities during the pandemic?
Yeah, and it's not just our research, but basically across the state and the nation. The research basically showed that definitely people of color suffered more from COVID-19, people with less means suffered more from COVID-19, and that is just sort of a highlight of how health inequities play out today, whether it's cardiovascular disease or diabetes. It just seems like every time you break down a health issue, there is that racial inequity.
Yeah, and can I just have you expand a little bit more on those root causes?
Yes, and so root causes are racism, they're isms. We just did a community health needs assessment in our region and found that people who identify as LGBTQ and trans, you look at their health outcomes and it's very different from folks that don't identify in that way. And so it's a root cause of basically having different groups of people have different access to what they need. And that is really what public health is trying to emphasize right now.
And how did our region address these disparities?
Well, so the state started a vaccine equity initiative. So that is one example where they recognized in certain communities across the Commonwealth of Massachusetts that there was less of an uptake of vaccines. So basically putting more resources into communities that quite frankly are predominantly communities of color. That is a way that they were trying to address that. More information, more access, more outreach workers, more funding.
And so in terms of, removing these issues that lead to health and other disparities among underserved populations, how can the state or federal government do that?
Well, I think it's all of us that basically need to work on addressing inequities, and there are things going on in lots of different sectors, healthcare and schools and obviously public health, where we are trying to learn more about 400 years of oppression, where some groups of people were basically left out of a wealth and economy growing system. And that does continue today. And so really trying to get people to understand their own implicit bias. How do we show up in sectors? How do we show up in the world? And then what are the policies and systems change that we have to basically break down so that people have more fair and equitable access?
Yeah, I want to touch on this for a second. The Institute has a race and health equity resource guide. Mm-hmm. So what is the guide and who was it created for?
Actually, our board of directors several years ago created our Race and Health Equity Resource Guide with input from many different groups around the region and actually pulled from resources across the country. And really, it was about trying to put practical tools into people's hands that want to learn more and then move along a continuum about being either an anti-racist organization or a multicultural organization. But there's also tools on that website for people, individuals. So individuals, organizations, institutions.
And so what are some of your concerns now that pandemic emergency measures and mandates have been lifted?
Yeah, well, there are things being put in place to address concerns, but originally there was not a lot of information about exactly what would be left in place when the emergency was lifted. So we were worried about people losing housing vouchers or not having the same SNAP, the Supplemental Nutrition Program, access. We were worried about people having to pay for vaccine and testing. And so a lot of those things basically are coming out now through the state and the federal government to basically make sure that people still have that type of support.
And how about some of the policies that you're advocating for at the state level?
Yeah, so our policy priorities are around housing, they're around air quality, they're around youth mental health supports, really a wide range of issues, but all of which have been said out loud in our region need to be priorities for Western Mass.
And so the 2023 county health rankings are now available on your website. How is that information put together?
Yeah, the county health rankings are something that the Robert Wood Johnson Foundation funds, and the University of Wisconsin actually collects the data across the county across the country for every county. And so you can go to their website and look at Massachusetts, and we have highlighted a couple of the maps that they've put out with regard to the 4 counties of Western Mass. And so basically you can see things like length of life or quality of life, or the ratio between a person to the amount of healthcare providers. And so it's a very interesting tool. They update it every year, and it's interesting to look at.
So for Western Massachusetts, was there anything that kind of was surprising or something that fit right in line?
Well, it was a little surprising this year because a couple of the counties had been, so it's kind of 1 through 14, if you will, 1 being the healthiest versus 14 being the least healthy. And so there were some changes in some of the categories between the 4 counties of Western Mass.
And what's the best way for the community to take a look at that again?
They can go to www.publichealthwm.org. We have the county health rankings for Massachusetts on our website, or you can go to the countyhealthrankings.org.
Yeah, and so again, as we continue to move away from pandemic status, what are some of the things that you're hoping our community members can take away from all of the information that you've been able to put out there for them?
Well, first of all, it's really important to know where to go. So a lot of municipal websites have very local, up-to-date information about COVID-19 on their websites. For basic health resources, the Massachusetts Department of Public Health also has updated information. But we also have an e-newsletter that we try to highlight updated information as well, and people can email us at info@publichealthwm.org if they'd like to sign up for that.
And is that newsletter something that people can sign up for?
Yes.
Oh, okay.
And it comes out monthly.
Okay, so it comes out monthly.
Mm-hmm.
And are there any other meetups or any other groups or chats, things like that people can get involved in?
There are, and there's a lot of terrific people organizing across the region. In Hampden County in particular, there is the Hampden County Community Health Improvement Plan group, and so they meet monthly, I believe. They share resources and local information, and they're always welcoming new people.
All right, thank you so much for your insight. We appreciate it.
Thank you.
Surveys were done to gauge people's concerns as we move out of the pandemic. We'll discuss that result after the break. You're watching 22 News in Focus. Back here now, you're watching 22 News in Focus, and joining us we have Sarita Hudson, Senior Director of Programs and Development at the Public Health Institute of Western Mass. We also have Jessica Collins here with us as well. So I want to ask you now, why was there a need to have these types of surveys conducted?
All right, so there were a couple of different surveys. The Massachusetts Department of Public Health did a COVID-19 community impact survey a couple of years ago, which provided a lot of information about what types of resources and information do people need and what did people actually suffer through during COVID-19, very specific health-oriented. The survey that the Public Health Institute just did was specifically about the emergency mandate ending, and we wanted to understand basically for professional organizations that provide direct services, what were they hearing from their people, their constituents and clients that those folks were most concerned about with the mandate ending.
And who was being asked to complete these surveys?
It was basically organizations that provide direct services in our region, behavioral health services or elder services, housing services, et cetera, as well as residents. Most of the respondents were from community-based organizations.
And the survey focused on several areas. Could you just break down these areas a little bit for our viewers?
Yes, so that basically focused on what are you most concerned about with regard to the emergency mandate ending on May 11th. The second was where do you get your information, because that was a lot of what people struggled with during the pandemic, is what is the trusting source of information that you would go to. And then the third was about 413 Cares, our resource database.
And who was involved in organizing the data?
Well, our team, basically, we collected the data and then we organized it, and I'll let Sarita share some of our findings. Yeah.
Right, so some of the findings were people were very concerned about the ending of the SNAP benefits. So those are the food benefits. That was a big concern that people had. What is going to happen? What's going to happen with housing? So there were a lot of concerns. We know we're facing an affordable housing crisis here in Western Mass all over, and those are things that came up in the survey.
And what were some of the top concerns from respondents?
Well, I think there was more concern because there wasn't that much information at the time about, okay, we're lifting the mandate, but here's what we're keeping in place. Mm-hmm. So basically it was about, can we still get free testing and free vaccines? You know, can we still get free the medicine? And then what Sarita said around food support.
And so we know that there was a lot of misinformation, you know, during the height of COVID as we transitioned throughout the pandemic, and we saw a lot of that on social media. Who did the respondents say that they trusted for COVID information?
Yeah, that they said their local municipal health department, which was great. The state department, their healthcare provider, friends and family. And then people did mention organizations like ours, the Public Health Institute, and other regional organizations where they are already connected to.
And if there were to be a new survey, what do you think some of the topics that you would include would be?
Well, the other question that we asked them was about resources. So we have this database called 413 Cares, and we really wanted to ask them about how can we augment this? How can we make it better? How can we make it more useful?
Yeah, was there something you wanted to add?
Well,
to
I
that?
could talk about 413 Cares. People said that those who use it really find resources on it. But many people either didn't know about it or felt like, and they didn't, you know, they forgot about it, and it made us realize we need to do more promotion and get the word out because people are looking for resources. And with the pandemic being shut down, locked down, all of the different needs that came out in all of these surveys that Jessica spoke to earlier, we realized we need resources, and it just was serendipitous that 413 Cares started and launched during the pandemic and was able to provide those services.
Yeah, and the COVID Community Impact Survey was done in partnership with the Massachusetts Department of Public Health to better understand the immediate and long-term health needs facing the state due to the pandemic. There were two surveys, one for adults and one for youth. Why two surveys for these age groups?
Because youth, there are different questions for youth. They have different experiences, so you really want to have two different surveys so you can really get better information.
And do you recall some of the questions that were asked on those surveys?
Yeah, I mean, they're typical public health questions like, you know, how do you feel isolated, or So their behavior questions: are you still as physically active, or are you drinking alcohol more? Are you smoking, more tobacco? That type of. And then there were other questions about: have you been able to access enough food and enough, what's your housing situation? So it really got very specific information from people.
And what were some of the major takeaways? You mentioned alcohol use, and those were things that we all, we've read about skyrocketing, things like that. So what were some of the major takeaways?
Well, there were inequities in the impact of COVID-19 and the impacts based on all these social determinants of health, all the things in the world, like food and access to housing. There were inequities. So people who were low income, people of color, people with disabilities, LGBTQ plus folks experienced greater impact. And so you would see that the rates of alcohol or substance use, all of those things, it would be things like that you saw inequities.
And in terms of organizations, did you receive any requests from any groups that were looking for information from these surveys, and what exactly were they looking for?
So some of the groups that we looked at, they wanted to understand the substance use versus social determinants of health, and that was true in Hampshire, Franklin, and Hamden. People wanted mental health data. We're really seeing a crisis in youth mental health, and that's something that people were really looking for, that data. The impacts on LGBTQ plus individuals, and domestic violence. Those were some of the requests that we've gotten.
And what services do you provide to organizations regarding the survey results?
Well, we work with organizations. We get them the data. We talk with them about it to make sure that the data is understandable, and then we work with them around how are you going to use this data? How to put this out, and what are strategies to address it?
And were there things that you thought worked well but could maybe be better, moving forward?
Well, one of the things that we know is that there are some people that we didn't reach, that the survey didn't reach, and so there are communities, some immigrant communities, that didn't show up. We didn't get enough numbers to really have valid data. So I think that is one of the key pieces, the takeaways for the next, is whether or not doing a survey, whether there would need to be some kind of focus group or other strategies to get people in to really make that survey more robust.
Yeah, and just talking about ways to make people more intrigued, right, to want to respond, because ultimately that impacts, the community as a whole.
That's right.
All right. Thank you so much for you both being here on the program.
Thank you.
Thank you.
The Public Health Institute of Western Mass has an online portal that offers social service and other resources. We'll find out more once we return. You're watching 22 News in Focus. Back now with 22 News in Focus. We've been talking about the impact of COVID-19 in Western Massachusetts. In April of 2020, a new online community resource database for the Western Mass region, 413cares.org, was launched by the Public Health Institute of Western Massachusetts and Bay State Health. The idea was to create a portal that provides information to connect people to essential resources in Western Massachusetts. So, Sarita, thank you for sticking around on the program with us. And I want to ask you, why was the portal created?
Well, one of the things that was happening is we had done a survey of social service organizations to ask them what did they need to better connect with healthcare. And what they said was a reliable way to get referrals and to share information. So we took that survey data, and this was also at the same time Bay State Health was saying, we need to have some kind of online resource database that people can share. And so with that group of folks, we got together, we looked at we held a process to invite 10 different companies to look into this database. And then we brought in 3 based on the requirements that our committee had set up. And then we asked community members and social service groups to say which of these they liked better. And they chose the Find Help platform. It used to be called Aunt Bertha, now it's Find Help. And so we decided to go with that so that it could solve that need of how do you communicate together about the resources, how do you collect those resources and keep them up to date.
And what are some of the areas of need that you provide resources for?
Well, it's everything from housing to food to digital resources to mental health care, addiction services, mentoring. So it's all across the board, social services that are free or reduced cost.
And what can people expect to find when they use this guide?
Well, you go in, you can just click on, put your zip code in, because you want to get just resources that apply to you and your community. And then you can click on the different tags. You can say, I'm looking for a food pantry, find all of the food pantries in your neighborhood that serve you. You can also go through, they have different tags, different categories. You can click around in those categories. So you can either search and find those services you need.
Do you have any numbers on how many people utilized 413 Cares during the pandemic?
We had over 20,000 people use it and making over close to 80,000 searches.
Okay. And do you know if many people, or did you rather track which resources were in most demand?
Right, that we did, and the most demand was housing and food, and then after that it was health, it was care, so health care, so that could be anything from mental health to addiction to other kinds of healthcare services.
And it's not just people that are seeking resources. The site also offers information about training for organizations. So were businesses and community organizations in contact with you to utilize these services?
Right, what we have found is that many partnerships wanted to use our website so that they could share information. So at the beginning of the pandemic, we included a lot of COVID resources, things that were not just direct services that people could go and refer themselves to and click on and get food, but just general information. What do I do with an eviction? How do I manage the information on COVID vaccines? So that kind of information was there. What we have found as time has gone on is that different organizations, different coalitions are coming to us and say, hey, can we use your website to spread the word about the work we're doing? The Hampden County Community Health Improvement Plan, they came to us and said, we want to do a mentoring campaign. Can you help us with that? Break the Stigma, which is a campaign around addiction and recovery. They used our website, working with the Greater Springfield Opioid Crisis Collaborative. So we're finding different organizations are looking to this as a key resource in our community.
And so you had mentioned vaccines, you had mentioned testing and treatment as well. Did you see that there was a lot of demand for those specific resources?
Well, what we found was that people were coming looking for different services, and so we don't know where they went, whether or not they took advantage, but those resources were definitely available on our website, where to go for those.
And the site also had links to municipal reports with profiles for multiple Western Massachusetts communities. What information is contained in these reports, and how do they provide insight into the COVID-19 response?
Right. Well, these reports, we prepared them for different municipalities, and we took some of the just the census information. So, how many people live in the community? How many people of color? What are their incomes? Things like that. So it had census data. It had the data on COVID. How many people in their community tested positive? How many passed away from COVID? And then we also put in information from the community survey that we mentioned before. So what were the key pieces? What were people most worried about? What were the substance use issues? What were the access to food? What were people's concerns in that community? So if you're from Westfield, you can go in one of these reports and really get a snapshot of your community.
And so is that the Western Mass COVID-19 County Data Dashboard, or is that something different?
That is something different.
Okay,
these are municipal reports that are on the 413 Cares. They're also on the Public Health Institute website. But the idea is just to say, if I'm from Westfield, if I'm from West Springfield or Chicopee, can I go in and take a look and see and understand what does my community look like? What are the needs because of COVID? And then what resources are there on 413 Cares in my community?
Okay, so the COVID county data dashboard. Let's have you talk about that one.
Well, that is the dashboard that we referred to earlier.
Okay.
That was on the Public Health Institute website from early in the pandemic. People were asking, what does it look like in our community, in our county? And this was where we got DPH data and we made it digestible. We made it really clear, and that became such a useful resource. We had people saying, I print it out every day and I would use it in the community to tell people about where there's higher risks. So when the risk went up, people would be able to use that and say, this is when you need to be safe. You need to go get vaccinated, go get tested if you're feeling sick. So that became a really key resource. We even had legislators saying, thank you so much for doing this dashboard.
And how about in terms of comparing the data, where there was some communities and counties that did better than others in prevention and vaccine testing, other issues? Yeah. Where did that data come from?
Yeah, so in terms of that data, we, we're using the same data sources. We're just trying to digest it and make it easily usable. Because one of the things about data is there's tons of data out there, right? But if it's not in a format that people really understand, then it's meaningless. And so that's really what's been the work that our research and evaluation team has done, is they figured out a way to do it and make it really useful for the community.
And how about feedback for 413 Cares? What's the feedback then?
Well, the feedback that we've gotten from 413 Cares of the people who use it, more than like 60% of people find the resources they need either always or most of the time. And then another 30%, some of the time they find the resources. We know that sometimes people don't find resources because they don't exist. When it comes to housing, which is our top need, we have such limited housing resources in this area. And I know that there's a lot of legislative work and a lot of community work coming together to say, how are we going to get more affordable housing? How are we going to address the issue for families or individuals or people facing domestic violence who need housing?
Will 413 Cares continue?
Oh, absolutely. We have support from Bay State Health. We've had support from an earmark, and the community partnerships are coming together, and they help support us as well.
So when you talk about support, is that how your site is being funded, or how's
Absolutely.
your site being funded?
Okay. Yes, we're being funded through Bay State Health and through the earmarks and these community partnerships.
Okay, Sarita, thank you so much.
Thank you.
And while the national emergency may have ended, the COVID-19 virus is still not out there. So we'll talk with a doctor about what we can expect in the future. You're watching 22 News in Focus. Welcome back to 22 News in Focus. With pandemic restrictions removed, people are working to get on with their lives and creating a new normal. But the coronavirus is still out there and is here to stay. Some people who were sick from the virus haven't fully recovered and face a wide range of ongoing health problems from long COVID. So joining me now to talk about the long-term effects of COVID-19 is Dr. Esteban Del Pilar, an infectious disease doctor at Bay State Health. We thank you so much for being on the program.
Thank you for having me.
So I want to have you talk about the symptoms of long COVID. It's a term that we hear a lot, but what exactly are those symptoms?
So when you talk about long COVID, you're talking about what happens after the infection. So you got infected, you suffer the symptoms from that. The infection is gone, and now you have these symptoms. And you can basically put these patients in three big buckets. The first one are patients that have a lot of fatigue, very common symptom. And usually they have some kind of pain, whether that's joint muscle aches or sometimes mood swings. The next big bucket is patients that have cognitive issues. So the most common complaint that we get is patients that have mental fogginess. I can't think straight. It takes me so long to do normal things that I used to do really quick. And the third bucket is patients that have ongoing respiratory issues. So as you can see, it's a very broad category of symptoms that can go from kind of a nuisance to life-limiting.
And so if somebody had COVID before they were vaccinated and now they're vaccinated, does that lessen their chances of getting the virus again?
It does. It's very interesting because if you look at the data for long COVID as a whole, there's some older data that said that, if you got vaccinated, you had a 15, maybe 20% chance of not getting long COVID. But with more recent data, it seems that if you got the vaccine before you got an infection, you have about a 30% chance of not getting it. If you got the vaccine after you got infected, you still have a 27% of not getting long COVID. And a more recent study that came out of, I think it was Hopkins, showed that even patients that get the infection, develop long COVID, if you get the vaccine, it actually decreases your symptoms and makes you recover faster. So the vaccine is a wonderful tool that we have, not only to prevent it, but actually to improve your symptomatology if you were to get long COVID.
Okay, so it's summer travel season is here. Kids are out for summer break. People are moving away from, the pandemic with all these restrictions and mandates now being lifted. So should adults and children continue to get vaccinated?
I don't think you'll find a single infectious disease doctor to tell you no to that question. So the answer is yes. Please get vaccinated. The best tool that we have to avoid problems is a vaccine, because it not only will decrease your chances of getting it, but more importantly, if you get it, you're less likely to get very, very sick. You're less likely to end up in the hospital. You're less likely to die.
And there are new variants out there as well, right? So how are those new variants impacting people?
So there are some variants out there. There hasn't been a major variant since we got the Omicron. Omicron has been very interesting because we've gotten a few brands of Omicron itself. But it's interesting because we've seen that when we compare it to perhaps Delta or the Alpha, the original strain, people are not as likely to be very sick, not as likely to end up in the hospital. Some of that is likely because we have a lot of people that already had it, so they have some antibodies. We have a lot of people that got vaccinated. We had a lot of people that actually got it and got vaccinated, so that helps the disease be less bad.
And health inequities came to the forefront of national news during the pandemic as well. Some people were at increased risk of getting sick from COVID because of where they live or where they work, or because they can't get the care that they need. So who's more susceptible to becoming extremely ill from COVID-19?
So for COVID-19, it's more or less the same thing as all the respiratory viruses. If you're older and, by medicine 65 and plus is, I don't think that's too old, but 65 and plus, that's what we would consider as dementia, or there and above. You have a high risk of getting very ill. If you have any conditions from your lungs, people that have asthma, that have COPD, or anything that messes with your immune system. So you have your patients that have organ transplants, you have your patients with HIV, you have your patients that are on certain medications that suppress their immune system because they have rheumatoid arthritis, Crohn's disease. Those patients are at very high risk. If you take those patients out of the equation, the next populations that are usually really affected are our population of color, particularly our Black and Hispanic population. And it's typically has to do with the social determinants of health. We are more likely to be working in jobs that we can't really call out. So even if I'm sick or not feeling well, I'm still need to go to work. We're more likely to work at positions that we are exposed to the public. So that population held and took basically the brunt of COVID. And a lot of the things that, at least here in Western Massachusetts, particularly based as how we did, was to try to address that. And you've already talked about that throughout the segment.
Yeah, and so I want to touch on this because much like COVID, the flu can cause extreme illness as well. People die from it every year, but so many millions of people opt to not get the flu vaccine. So moving forward, do you think there's going to be this push to get people to get vaccinated against the flu as well?
We always try to push as hard as we can to get all of our patients vaccinated, not just against the flu, but all the routine diseases that we have vaccines for, COVID being a major one now. It has to do a lot of times with where people are getting the information, my mom's friend or my neighbor, or I read this thing on this post on Facebook. Those are not the most reliable sources of information. That's why I tell you, talk to your doctors, talk to your health leaders, talk to your local board of health, and they'll give you the accurate information. And I understand that for minority groups, there's a lot of distrust, sometimes because of historical issues, to the medical community, but sit down, talk to your doctors, go through the data, and get vaccinated. I always tell my patients, I'm not going to tell you to do something I don't. I'm vaccinated against the flu, or I got all my COVID and COVID boosters, so if I'm doing it and I'm a doctor, you should probably follow suit.
Yeah, and so in terms of what you're seeing on a day-to-day basis, are hospitals still seeing COVID cases?
We still see COVID cases, not as much as we had been at the beginning of the pandemic. We are at the lowest numbers we've had since the pandemic started. But we still get these patients in the hospital a lot of time. Some of them will end up in the ICU or needing significant support from the doctors to kind of make them get better. So it is still around, and you can still get sick enough that you might end up in the hospital.
And is the medical community concerned about another COVID resurgence?
Yes and no. We are apprehensively optimistic. What we've been seeing right now since the Omicron variant is that the disease changed a little. It's not as severe disease, and with the vaccines and the other tools that we put into the community, it seems that we've managed that to a certain degree. Could a variant come out of the blue and change all of that thought process? Of course, but we are, and I particularly am hoping for a very boring summer when it comes to infectious diseases.
And now that we've, lived through this pandemic, would you say that the medical community is prepared for something like this if it were to happen again in the future?
I think that we have a better idea of what to expect and what our challenges will be. The things that we would need to do to prevent all the problems that we had through COVID, we will have to start working on them now. Western Massachusetts, particularly in this area, we were fairly well prepared because if you look at just Base Health, our CEO is an infectious disease doctor. The president of our medical society, of our medical group, is an infectious disease doctor. Our chief of medicine right now, she's an infectious disease doctor. So we were all very keen on this is happening. We need to start working on it. So we were not impacted as much as other states, particularly in the South and New York. So the things to prevent problems in the future with a similar issue needs to start happening now. We have the knowledge, we just need to apply it.
Yes, and quickly because, we lived through this, like you said, right? People are continuing with their lives, traveling, summer's here. What steps can we take to make sure that we're staying safe throughout the summer?
The things I tell all my patients is wear sunblock. Use bug repellent because COVID is around, but in summer we get a lot of mosquito and tick bites that those can transmit a whole slew of infections. And if you're traveling anywhere, talk to your doctor. You'll be surprised how many people don't know that if you go to this or that place, you should get this vaccine or you should use these medications as prevention. So the best thing that you could do if you're traveling outside of the area, talk to your doctor to make sure that you don't have to take any extra steps.
All right, Dr. Del Pilar, thank you very much. And I'll have some final words after a short break. You're watching 22 News in Focus. You've been watching 22 News in Focus, and we've been discussing how the COVID-19 pandemic impacted the health of people in our region and what we may expect moving forward now that the emergency has been canceled. Thank you to all of our guests, and for you watching at home, if you missed any of our program, you'll be able to find it in full on our website. That's wwlp.com. From all of us here at 22 News, have a great day.